So good morning. I have with me today Dr. Pearlstein, who works with Suburban Geriatrics and also serves as Frederick Living Medical Director. And we're grateful for you taking the time with us this morning, Dr. Pearlstein, to talk a little bit about the COVID-19 vaccine. And as you're aware, we're getting ready to host clinics here. And we understand that education and information are critical, not only for our team members, but for our residents and their families, as they think about participating in this vaccination process. So I'm glad that you joined me. I've got a question for you just to kick it off, and then you're welcome to provide some other education and information. But I wanted to start with you this morning. You mentioned yesterday in a conversation something that was really interesting to me, was that this vaccine hasn't really been developed over the last 6 to 8 to 9 months, as most people think, that really this has been in the works for years. And I wonder if you would just take a minute here to explain that comment to me, so that all of us can kind of understand how we got to this point in having a number of vaccines so quickly.
Sure. Well, I'll actually start with a little bit of education, because I think that one of the concerns from the medical community is the misconceptions about the whole COVID-19 vaccinating and goals of what we're trying to do. And I think that the biggest misconception is that this vaccine was put together very hastily over a couple months, and that because of the name warp speed, we see that, or we have the perception that a bunch of companies were thrown a lot of money and said, make a vaccine, and they weren't done appropriately. So I can explain why and what this really means. So about 8 years ago, the decision was made, or they figured out a way genetically called messenger RNA. And if you remember back in high school with RNA and DNA, this is what our body is made up of. This is the mapping of our body. So the theory was, the theory was from about 10 years ago, that if we can have messenger RNA, which develops cells, why can't we change the message to make it fight infections that attack our immune system? So 8 years ago, 4 or 5 companies started with this new mRNA, messenger RNA vaccine. So many companies had started and had developed it. Over the past 2-3 years, we were at the point where it was about to be used. So what the messenger RNA does, it triggers an immune response. So when you're looking at the vaccine itself, there are no live germs. It is all synthetic. It teaches cells how to make proteins, and those proteins make antibodies. So that's what the theory is with doing this new phase vaccine. The best part of this was that up until 9 months ago, many companies were all doing it themselves. Starting in March, for the first time ever, the whole world, all of these brilliant scientists, chemists from both the private sector and the public sector got together. And these are from all over the world, and finished what was 90% done and finished it together. So this vaccine is really a compilation of just brilliant people finally finishing this vaccine and having it work. And some of the proof of that is why when you read about the Pfizer vaccine and the Moderna vaccine, if you notice, all of the data are almost exactly the same. The efficacy is the same. The side effect profile is exactly the same. Why? Because they're all the same vaccine. They're all being produced by different companies, but they all came to the same conclusion. And that is why this is not something that was hastily done. You could say that it was ramped up at the end to finish it, but the most of the work was from many years ago. Does that answer your question?
Yeah, absolutely. So I know that in conversation with you, you recently had the vaccine, had the injection, the first of two phases. Maybe just share with me your thought process as you made that decision. And then I know that you have 3 or 4 other talking points, and you're welcome just to lead into those, but maybe share a little bit about your own personal decision and how you came to that.
Well, I look at things. I'm a math guy. Obviously, I went to med school, and I believe in the math, and I love looking at data. And when you, it's very transparent when a drug company goes to the FDA in order to get approved for a medication or vaccine. There's a lot of data that's involved, and the data is everything. And the data has 2 parts. It has the positive part and the negative part. So how's it going to help? Well, everyone knows, and everyone is feeling the brunt of this pandemic and all of the problems, not only from a medical side of things, but from a social side of things. So the positive, if it works, is very important. The efficacy, meaning the amount, the percentage of people that get the vaccine that this is effective for, is over 95%. I think that's a pretty staggering amount. The flu shot is only about 70 to 75%. So this is much, much more efficacious than the flu shot. Then you have to look, obviously, at the downside. You have to look at the negative. And what side effects do we have? What potential problems we have? And that's actually more documented than the positive side, because that's how the FDA decides on whether or not these are safe or not. When you look at the side effect of over 100,000 people had this vaccine between Pfizer, Moderna, AstraZeneca, and the 2 companies from the UK have all been tested. And the side effect profile is minimal to none. Now, I know that, people have heard about the 2 people in England and the 3 people in Alaska. They were all allergic reactions. The good news is they were all fine 15 minutes after the shot was given. They had a reaction to the shot. They were given epinephrine, which is an EpiPen, and they were all fine. None of them had to stay in the hospital. They were all, doing well. That is from a specific allergy. There is no egg in this. This is synthetic. They found that all 5 people that this happened to have had multiple allergies to multiple substances. So this is not something that I have allergies and I cough a lot. That's not an allergy. These are people that actually carry EpiPens because they've had problems in the past. So when you look at the downside of this shot, I mean, the one other downside is, in a year from now, we don't know if we're going to need another shot. We don't know, because we don't know what the virus is going to do, and we don't know how effective this virus is after a year. But we do know that for 1 year you have fantastic. You are safe for 1 full year, and then we will know in the next 8-9 months whether or not we will need another vaccine, or what the actual virus will be doing. So that's what went into my mind to do it. So last Thursday morning, I got the shot, and honestly, it was a relief to get it done. My only side effect, I had a sore arm for about 24 hours. That's why I had it in my left arm. But other than that, I did not feel a thing. There were 60 doctors had it done last Thursday morning, and we had a questionnaire 48 hours later, and not one person had one side effect except other than the sore arm.
Great. So I know you had talked to me earlier about some talking points related to, the vaccine itself, but also just the population that they're targeting and why that's important and where we're headed. So maybe you could just speak to that a little bit for the group.
Absolutely. When the vaccine is being rolled out, and if you have been reading, and the CDC has their recommendations, and everyone kind of has, and each state is allowed to kind of tinker a little bit with this. The most important thing is we have to target those at risk. And people always ask me, well, am I at risk? Who's at risk? Well, age is a risk factor, but so are a lot of other problems, such as cancer, such as diabetes. it's important at risk people, because the people that get coronavirus, the more risk factors they have, the poorer outcome there is. So we need our frailer elderly to get this vaccine. It's been a horrendous 2020 in the nursing facilities. Some facilities a lot worse than other facilities, but it's been horrendous. There's been many, many, many deaths, unfortunately. And the most important thing now that we have a vaccine is we need to get those people at risk vaccinated. And I know that the first line people in the hospital are being done as we speak. And in the next 2 weeks, the nursing facilities and employees will be started. And that's, I guess, one of the reasons why we're speaking today is the population in the nursing facility is at risk. And even as healthy as an 88-year-old can be, they're at risk. Another thing that we need to understand is immunization must be population compliant. What does that mean? It doesn't help if just the at-risk population gets vaccinated. We need a percentage of our population in this country to be vaccinated in order to make a dent and to get rid of this problem. Depending where you read, the number is upwards of 70% of people in the United States needs to be vaccinated in order for us to stop wearing masks, being able to go, stop social distancing, and go back to our lives as we know it. For those that don't get it, it's a problem. Immunization will protect those who cannot or will not be immunized. So if you don't get immunized, you become a vector for this vaccine, for this coronavirus. And unfortunately, even though X amount of people cannot get sick from it because they've had the vaccine, it's still jumping from person to person. We need to cut the amount of people that it's going from person to person and shut that down. And unfortunately, not everyone will be able to get this vaccine, whether it's you live in an area that they're rural, you can't get out of the house. There are reasons why people won't get it. Those people are at high risk. And even though a lot of, say 50 or 60% of our country will get vaccinated, we need it to be higher in order for those people not to be at a higher risk. So, this vaccine is not only for you, but it's for your fellow people.
Okay. So we've heard a lot about, the groups maybe that should think about not getting the vaccine. Can you speak to that in terms of from a medical perspective, as you think about that? Are there groups that you would say should think twice or that need to speak with their physician before they would get vaccinated?
Well, if you go through the data, there are a couple questionable populations. Pregnant women is one, which hopefully we don't have any residents that are pregnant. But the data shows that there were women that were pregnant that were in the trial that hadn't known they were pregnant, and they're all doing fine. So, that's one group that I would question. I don't know how much asking your doctor is going to know, because I don't think your doctor knows much more than the general population knows. People that have had multiple allergies is someone that I would be concerned with. That carries an EpiPen, that has serious allergies, maybe a peanut allergy that they've had an issue with, or allergies like that. Other than that, even children, the Pfizer vaccine is for people for 18 and over. The Moderna is 16 and over, and the AstraZeneca, which is going to be the next one out, is 12 and over. So they're finding that in children it is safe. They just need enough more data in order to be able to do it for someone. I don't know of any groups that are truly should be questioning this vaccine.
Okay. And then could you also clarify, there's a lot of questions about what the vaccine actually prevents. As I understand it, it prevents you from getting COVID-19, but there's still questions, right, about whether somebody who has the virus can pass that on to somebody else. Is that correct? Or explain that. What are we actually being protected against?
So I'll give you some of the data from the Moderna study. So 40,000 people were studied. Half of those people, 20,000, were placebo, and 50%, 20,000, were given the shot. In the placebo, meaning they did not get vaccine, 180 people contacted coronavirus. In the group that got the vaccine, 18 people got the virus, but all of those 18 were asymptomatic. Of the people that got the coronavirus, of that, over half of them became very sick and needed ICU treatment. So yes, if you get the vaccine, you can still get coronavirus. It's just not symptomatic. So the question is, if those 18 people were able to get the coronavirus, most likely they are able to spread the virus also. Probably not at the same limits and levels, but at least they will probably be able to. So again, this is why the more people that are vaccinated, the less vectors we have out there.
Okay. So I know in talking with some people, at Frederick Living and other places, one of the concerns is that there's no history to this, right? With the flu vaccine and others, we have a long period after those were vaccinated to see if there were long-term side effects. Obviously, those individuals that got this vaccine, it's only been within the last couple months. How would you respond to those people that have that question, that there's not a long history to this vaccine?
I think it's a good question. I think it's something that is something to think about. I think the good news is that we're dealing with a different kind of vaccine now. We're not dealing with we're actually dealing with this new mRNA. And because of that, when this vaccine was developed, it only builds proteins. It is not like the old-fashioned vaccines that used to be live vaccine, and you never knew 8 months, 10 months, 12 months down the road what that vaccine would turn into. This is much more calculated. This is much more, they know how mRNA works, what it develops and what it makes, and then what's going to happen to it in the future. So I think that this is the whole protocol, and the reason that 8-10 years ago the decision was to go this route was because it's a much safer route.
Okay, great. Well, thank you very much for joining us. This is the conclusion of part one. Part two will be a question and answer session where managers and supervisors at Frederick Living can ask Dr. Pearlstein questions. And so if you're interested in that, join us for that second session.